It's just in relation to the assessment of needs for children with disabilities in Dublin Mid West. Now, obviously, this is a crisis of our time in some ways. This is mirrored across the state, where there is huge waiting times for children to be assessed. So my question is, the assessment of needs, why are children, which are early intervention is key, why are they waiting so long at this moment?
Thank you, and just to thank the Deputy for raising really what is an extremely important issue, and just to say that Minister McGrath sends his apologies. I am pleased myself, though, to take this opportunity to update the Deputy and the House on the progress underway in developing services for children with disabilities and the current position on waiting times for assessments of need, which the Deputy has pointed out in some instances are far too long. The HSE had recognised that early intervention services and services for school-aged children with disabilities need to be improved and organised more effectively. To this end, a major reconfiguration of therapy resources for children with disabilities aged up to 18 years is currently underway. This involves bringing staff from different service providers together into network teams, and it's called the National Programme on Progressing Disability Services for Children and Young People 0 to 18 years. The reconfiguration programme aims to bring about equality of access to disability services and consistency of service delivery, with a clear pathway for children with disabilities and their families to services regardless of where they live, what school the child attends, or the nature of the individual child's difficulties. There is also a stronger emphasis on the health and education sectors working more closely together in terms of supporting children with needs or special needs to achieve their potential. Implementation of the programme is taking place on a phased basis in consultation with stakeholders, and this includes service users and their families, which is key. It is a key priority in the HSE service plan, and by the end of this year it is estimated that 76 of a total of 129 teams will be reconfigured. Under the Disability Act 2005, a child can request an assessment of need. Since the Act commenced, the number of requests for assessments appear to vary across the country. The level of requests in higher areas where the The level of requests is higher in areas where the reconfiguration of children's disability services has yet to take place, and this would suggest that where a good service is being provided, the need for assessment is reduced. The HSE recognises that it faces significant challenges in respect of meeting the statutory timeframes which apply to the assessment of needs process. In your own area, Deputy of Dublin Mid West, the HSE is aware that there is a significant backlog in carrying out assessment of needs, and this is due to a number of vacancies in key roles. However, I am pleased to report that the recruitment process to fill these posts has been completed, and successful candidates will take up these roles in the coming weeks. The current programme for partnership government commits this government to improving services and increasing supports for people with disabilities, particularly for early assessment and intervention for children with special needs. Significant resources have been invested by the health sector in services for children and disabilities over the past number of years, and as you will be aware, health-related therapy supports and interventions for children are provided both through the HSE's primary care services and its specialist disability services, depending on the level of the child's need. In 2013, additional funding of £20 million was allocated to strengthen primary care services and to support the recruitment of over 260 prioritised frontline primary care posts. This included 52 occupational therapists and 52 speech and language therapists. Also, in terms of primary care services nationally, in 2016, €4 million was provided under the HSE's National Service Plan to focus specifically on speech and language therapy waiting lists in primary care and social care for children up to 18 years old. This investment represents a long-term increase in speech and language capacity that will be maintained into the next year. Arising from Budget 2017, the HSE are currently looking at how extra funds provided for disability services will be allocated. In particular, they will be asked to build on previous investments in the therapeutic supports. And I suppose just to finish, that my colleague, Minister Finian McGrath, obviously in line with the service plan, will be outlining how that money will be spent and in greater detail once the plan has been approved. Thank you.
Minister McGrath. Deputy Kenny.
Thank you.
Minister. Minister, I think we have a problem, because at the moment the waiting times are so long, it's contravening the Disability Act of 2005, which essentially means that somebody's child is waiting more than 6 months. The state is breaking its own law, and that's very, very serious implications for the state and also for the children, because obviously they're not being seen to. And there is a possibility that families can bring the state to court because they're not being seen to in time. Now, the stats are quite incredible when you look at it. There's a lot of children waiting up to 18 months for such services, 2,000 children under the age of 5 waiting for OT services, 20,000 children waiting for speech and language therapists. And even, it says, Inclusion Ireland has stated that speech and language services are greatly influenced by where you live. And even in Ireland, at the moment, there should be, there's 162 children to every therapist. What the recommendation is 30 to 65 children per therapist. So there's major questions for not only the assessments of needs when children and their families get them, but the bigger question is the waiting time for OT services, physio, and speech and language therapy. And in this day and age, nobody should be waiting more than 6 months. But across the country, not only in Dublin Mid West, Cork, for example, has a huge waiting time, over 18 months. It's just not acceptable, especially in this year of the 100th anniversary of 1916, where the proclamation says, cherish all children. But the state, at this moment in time, is not cherishing them children. It's actually failing them. And that has serious, profound consequences, not only for them families, for this state, that this country cannot provide services that are crucial, absolutely crucial, in their time of need for early intervention.
All right,
they're not
thank you,
getting
Deputy.
them. And that's, I have to say, it's a shame, shame, shame.
Minister McEntee.
I suppose just to say that I would agree with the Deputy in that our focus needs to be on the child, our focus needs to be on the requirements and the needs of the child. And I think up until now, really there has been no clear pathway. We've had a disjointed pathway, and I think with the new process and the reconfiguration that we'll hopefully start to see a process. I think this will only be resolved through cooperation between the departments, so not just health but education and also children, by reconfiguring obviously the resources. And I think the fact that we've seen already the 76 total of 129 teams that have been reconfigured, those that have been reconfigured, we have started to see an improvement. So obviously that process needs to speed up and it needs to happen as quickly as possible. But most importantly, we know that the earlier a child or a young person, the earlier we identify what it is that those child's needs are, then the easier it is to actually fulfil that process, and that requires staff, it requires teams, and it requires filling the posts. So I think that needs to be a priority. As I've said, your own area of Dublin Mid West, those vacancies have been filled, but obviously there are more vacancies like that throughout the country, and it needs to be a priority. So I'll certainly take this back to the Minister, and I've said I'm sure he will outline within the service plan where his additional funding plans to be spent as well.
Thank you very much.